Welcome to my channel, Rohit Speaks. And in today's video, I'm going to talk about is arthritis. So arthritis is the most common bone disorder which will affect the entire world population. It will affect the human beings who is walking, running, sitting. It will affect everyone, no matter what, but it will affect after a certain period of time, mostly when you are aging. So when I talk about arthritis or what is arthritis, basically it is inflammation or swelling of your joints, which is this joint right here, or your knee joints or your finger joints, wherever you have joint, that's swelling or that inflammation is called arthritis. Now, there are 5 different versions of it, but the most common which will affect almost everyone in this world is called osteoarthritis. And this is, I'm not saying that you will have it early on. It is an aging disease. When you age, the amount of use you put with these joints, you will develop some kind of arthritis. Now let's talk about different types of arthritis. So the most common one is osteoarthritis, which I'll be covering in this video. The other version is called as gout, which happens when you have uric acid crystals being deposited into your joints. So I'll talk about this in another video, but um, in this video, as I said, I'll be talking mostly about osteoarthritis. Now, the other 3 versions, they are almost commonly linked because in this case, what happens is your own immunoglobulin or your own immunity starts attacking your joints. So technically your joints usage has not gone up, but what has happened is your immune system is attacking that joint and it's swollen. And there are different versions of it. There is rheumatoid arthritis. When you have rheumatoid arthritis, you will develop this fibromyalgia. Basically, it's the pain across all the joints, all your joints, your here joint, this joint, all of those joints will begin to pain. And then there is systemic lupus, which affects mostly the women from their ages 15 to 45. So this happens when your own immune system starts attacking. It's an autoimmune disease, which I'll be covering in another video. So let's start with osteoarthritis. And osteoarthritis is basically your cartilage. So between your joints, between your two bones, there is this joint. In that joint, there is this cartilage, which is basically a cushion. So to allow your movement without any friction, to avoid that friction, okay? So over a period of time, when you use your bones, your joints, they will start to wear and tear. And that wear and tear, sometimes in some organisms or some humans might go faster based on their diet, their weight, and everything. So when your weight, diet, and everything fluctuates, your bones, your joint usage also different changes, right? A person who is overweight will have more stress on the joints. Person who is ideally weighted will be more less. So they will develop this arthritis at the later stage rather than the person who is obese. So that's what I'm saying. And osteoarthritis is governed at one of the joints. Not all of your joints will develop arthritis. It will be in one of them. All of the joints when have that problems is that fibromyalgia, which I talked earlier, but we'll talk about it in the other video. So osteoarthritis is basically this cushioning is starting to not evaporate, but starts to disappear or starts to go away. So your bones starts to hit each other, and then basically when something starts to hit, it will cause this coming off of the bone. So here you can see how the bone is smooth and have a certain shape. Once this cushion starts going away, they will start to touch each other and then they spur out. And that is most likely cause inflammation and swelling and will cause you a lot of pain. Okay. So can you avoid arthritis? A simple answer is no. A person or a human who is who is walking, who is doing some kind of activity will develop this over a period of time. It will not be happen immediately. Oh, you will have some kind of issue and you'll develop arthritis until unless you have done some kind of medication whose side effect is it will affect joints. So that's a whole different case. But a normal person who has a normal diet, normal weight, will also develop arthritis, but later in their age. Okay, so that's an aging issue. Can you live with arthritis? Of course, yes, you can definitely live with arthritis. How to do that? It's a combo. And I cannot stress that enough. With arthritis, you need is locomotion. You need to move rather than you think your joints are going to pain. Actually, more walking will help you. More movement will help you. Strength training. So with your joints, if you develop muscles to support it, it will also help you with maintaining your arthritis pain. So walk, try to have some kind of strength training. I'm not saying you have to weigh or use really heavy weights. Have small weights, but more repetition, so it develops your muscle strength, which helps your joint pain. Besides combo of exercise, healthy diet, try to reduce your weight, lose your weight, so there is not enough weight on your joints to cause that issue and develop arthritis. Besides that, besides your workout, your meal, you need to have some kind of medications. You can have pain relievers, which are analgesics, or you can have some non-steroidal anti-inflammatory. So when the joints are moving, they're scratching each other or they're going to touch each other, they'll cause inflammation and swelling. So to bring that down, you can use NSAIDs. There are counter irritants, which are lidocaine, capsaicin. Basically, they will numb that area. It's those balms you use, those are the ones which will help that. Or you can use corticosteroids again to bring the inflammation down. But not there is no one single drug which will help with this. You have to use a lot of things. So one is definitely exercise, strength training. Know when to, and don't do sudden movements with your joints. Don't be try to learn how to use load bearing, how to use a load bearing exercise or load bearing mode to lift things, do things. In the beginning, you will not pay attention. When you're young, you don't pay attention, but over a period of time, you have to pay attention to this because that's a long run issue. So if you pay attention now, at the end of the, when you're aging, you will be able to live with it and you won't be just confined to a wheelchair or to a bed. So always remember to move, to have some kind of exercise, some kind of strength training along with medication. One piece of advice which I would also give is to warm up before an exercise and ice your joints if it has some issues or if you have done some enough activity, ice it. Ice is another therapy. Icing yourself after a strenuous workout is a better way to avoid these joint issues. So in short, arthritis or osteoarthritis is something which you will suffer from down the road. But if you maintain yourself with a proper meal, proper exercise, proper habit of warming up and icing your joints, you will prolong this for a later time. And you will be able to live very comfortably, even though you will have some mild arthritic pain down the road, not immediate. So hope this clarifies what arthritis is and what kind of issue it happens and how can you live with it. In the next video, I'll try to cover some other aspects of it. Mostly I'll cover gout. So people who are suffering from gout get to know what exactly gout is, how it is happening, and what are the current treatments available. So I'll see you in the next video. Till then, goodbye.